The U.S. added more than 49,000 new cases on Sunday alone, bringing total cases in the U.S. to 2.8 million. And worldwide, there are now 11.4 million confirmed cases. And this morning, we learned that the medical products maker Becton Dickinson has received emergency use authorization from the FDA for its rapid COVID-19 diagnostic test that can deliver results in just 15 minutes. Joining us now to discuss the continued rise in cases is Dr. Dara Kass, Yahoo medical contributor and Columbia University associate professor of emergency medicine. Dr. Kass, thanks as always for being with us. I want to get right to this new rapid test from Becton Dickinson. What do you know about it, and what can we expect?
Well, this is something that I think we've been looking for a while, these antigen tests. These are the tests that you can use the same nasal swab to rapidly get results. They're not as sensitive, meaning that they're not as good as perfectly finding the negative cases. Sometimes you're going to miss some positives as the PCR test, the one that we send to a lab, but the turnaround is very quick. And so we're going to see an increased number of these antigen tests come to market. And we need to be a little bit careful that we know that when we saw a rapid number of these antigen tests, the antibody tests come to market under the EUA, we saw some that weren't as good. These are a smaller number of companies that are more reliable and coming out with a better product usually. So I'm optimistic, and I'm excited that we're going to see more of these antigen tests come to market. I think it's going to be very critical to us getting back to work reliably and understanding where the virus is.
I want to talk about the spike that we're seeing. We know that a lot of younger people are now getting the virus as more economies come off lockdown. A lot of people who are asymptomatic testing positive. If a person tests positive and is retested a week later and is still positive, is that counted as a new case, and should it be?
So it's counted as a new positive test. And the question is actually, we don't have good transparency in our numbers to know how many unique cases we have versus number of positive tests. And actually, I was thinking about this when we think about the sports teams doing scores of tests on their players over and over again to make sure they continue to stay negative. You would expect that a slew of those tests coming into the market would decrease the positivity rate because you expect them to be negative. But yet we still see an increased number of positive cases despite doing many more tests. So I think it all comes into context, but I think it's a very good thought. And we would ask for more transparency on the numbers, where they're coming from, what they represent, and more importantly, where are we going?
Dr. Kass, can you explain for the average person out there why we have not seen a rise over the past few weeks in the number of fatalities?
So I think that it's obviously, there's a lot of hypotheticals. We don't know for sure. One of the things I want to make sure we all understand is that just because you don't pass away of the coronavirus, it doesn't mean that it doesn't have lifelong effects on you. And we're seeing this a lot in the stories of 30-year-olds and 40-year-olds. They get the virus, they get sick, they go to the ICU, and they have a lifelong new chronic disease or really, really very high medical bills for their stay. What we think is that there's a delay in the death of the coronavirus. We're getting better at treating it. The younger people will rebound, but they may not be complication free, I would say. But I would say that we looked at the data for New York, and it's going to be about 2 more weeks until we see a really reliable understanding of whether or not the death rate did not rise with this increased number of cases. So I would still sit back and watch and see what the numbers are going to do.
Doctor, we continue to see Florida and Texas get hard hit. What are you hearing in terms of capacity at hospitals? Because it seems as though even the number of hospitalizations is now rising along with the number of positive test results.
And the number of ICU cases. I think that the numbers, what I'm hearing from the ground in Houston and Florida and Arizona is really just terrible. It is so reminiscent of what we dealt with in New York City. And actually now we're seeing that exposed healthcare workers are having a harder time getting tested themselves, which means that they're going to go back to the world we went to, where we didn't know if we were positive and we went back on what we thought was happening. It is the wrong direction. It's not a great way to keep the virus at bay. It's not a good way to get the virus under control and expand their economy back up. It is really just not good news.
Doctor, how concerned are you about hospital capacity right now?
Very. I think that we saw in New York City and the Northeast, we surged capacity, we built field hospitals, but we did that with a robust federal response. It was basically the only thing the federal government really did collectively was to give us those resources. We had the hospital, the floating Navy hospital come to New York, and we're not seeing those resources be mobilized in the Southeast and the South and the Southwest. And so I am worried that their capacity is going to get overwhelmed It's going to get into communities with 1 or 2 ICU beds and no ventilators. And that's really where it's going to get critically impactful to the care of the patients, regardless of why they're coming into the hospital.
All right, we're going to leave it there. Dr. Dara Kass, thanks as always for being with us. Have a great week.
You too.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.